Hello friends, today we're going to see about Homan sign test. It is a test that is very commonly done. It is also known as dorsiflexion sign test, and in this test it helps us to identify the presence of deep vein thrombosis. Now we are going to see how to perform the Homan sign test. Now before looking into that, let me tell you this test is done very commonly in patients who have been bedridden for a long time or who have not done any exercise even in their bed, such as the anti-pump exercise. So for them, there is much possibility to develop a deep vein thrombosis. So let me tell you how to perform this test. This test can be done in two ways. Now I'm going to do this test while the patient is lying on a supine position. Now flex the hip of the patient and flex the knee. Hold his ankle. Place your hand near the calf muscle. Now, as you make a dorsiflexion, press the calf muscle of the patient gently. Now, you can see there will be a tenderness when you press the calf muscle. You can look at the patient's face. There will be a grimace in the patient's face when you press the calf muscle. And also, compared to the other leg, in case if it has not developed the deep vein thrombosis, this area near the calf muscle will be red, it will be heat, and it will also be swollen. So these are the things that will help you to find deep vein thrombosis. Now we are going to see the other position in which this test can be performed for the Homan sign test. Now my patient is sitting on the table. Now the same procedure, but while he is sitting, I'm going to lift the leg a little bit and I'm going to dorsiflex it again and press the calf to see if there is presence of tenderness and grimace in the patient's face while I'm doing this. So this test, the Homan sign test or the dorsiflexion sign test, is a very good clinical test which is an indicator of the presence of deep vein thrombosis. Thank you. So this test, the Homan sign test or the dorsiflexion sign test, is a very good clinical test which is an indicator of the presence of deep vein thrombosis. Thank you.